Hello, everyone. My name is Danielle Delaney, and I'll be giving my cultural global belief or practice speech. My speech I'm giving today is on animal testing, which I believe is a cultural belief or practice. Because in the U.S., a lot of people don't believe in it, and a lot of people support the idea. I believe strongly on this topic, and I researched it quite a bit over the last couple of years. Sources that I've used for my speech today were from Xavier Burgos, his article called Animal Experimentation is Unscientific, Peggy Carlson's article Animal Experimentation is Unjustified, Thomas Dixon, Animal Experimentation, Debate-Based, Debate Topics and Debate Motions. Also, Gary Francione's journal called The Use of Non-Human Animals in Biomedical Research, Necessity and Justification. And lastly, Pat Thomas, Animal Experimentation Hampers Medical Research. Like I said earlier, animal testing is opposed by some and supported by others. There are several compelling reasons as to why animal experimentation is and shouldn't be conducted, and also only a few reasons that it should actually have bearing. Primary arguments against animal testing include the fact that it's not essential to medical progress, it violates animal rights, it is very, very costly, and research done in animals a lot of the times has a different effect than it does on humans. Supporters of animal testing and experimentation disagree. They argue that many invaluable medical advances have come about using animal experimentation. And also, they say if given the choice, they would rather contemplate animal suffering over human suffering. And my take on animal experimentation is that if it helps with medical advances and is supposedly greatly needed in our society, then why is it that so many researchers and scientists have proven otherwise? Some supporters argue that animal experimentation accommodates great advances in medical research. They believe that medical research has played a vital role in improving the quality of people's lives. However, there have been many medical advances that did not involve the use of animals. A very important detail that people tend to overlook is that many results produced by animal testing and experimentation do not correlate to human illness or well-being. And a quote that I would like to read to you from Burgos was, if your dog Fido got sick and were dying, do you think it would be scientifically possible, and I mean scientifically possible, to find a cure for your dog by conducting research on your healthy Uncle Walter? And I would definitely say that it is safe to assume that research done on humans has a different effect than it does on animals. And they both require different treatments and medical care. An example that I would like to bring to your attention is that research conducted on cancer treatments, the causes and cures, animal tests have been shown unreliable. And also, according to a 1977 Nature article, they quoted, of all the agents known to cause cancer in humans, the vast majority were identified by the observation of human population. And that was quoted in Carlson's article. Also, in the terms of medication, animal experimentation is also proven unreliable. Humans can take Tylenol as a pain reliever, but Tylenol is um, deadly to cats. So not only has Tylenol shown the differences of testing on animals for humans, but also before being released um, for clinical use, there's an antibiotic that was tested thoroughly on animals. This antibiotic was found to cause an often fatal blood disease in humans. Also, pharmaceutical drugs that are found safe for human consumption based on animal tests often cause massive damage and even death. Another quote by Burgos: if animal testing is a valid way of addressing human reactions to drugs, then why do so many serious side effects remain unknown until the human guinea pig is exposed to this drug? It is not only acceptable to test human medicines on human beings if they give their consent. Non-human animals are never able to give such a consent. It is therefore never acceptable to test medicines on perfectly healthy animals, even if the treatments for use on other animals. Um, this was another quote. This one was by Dixon. Some supporters would disagree with this statement, while many say that experimentation is wrong. Those that disagree with this statement, in other words, that agree with this statement, have claimed that it is because animals are incapable of making or responding to moral claims. So they can't participate in any social contracts. And therefore, we have no moral obligation to not harm them. But is it not true that many humans are incapable of the same? Despite the problems that I have gone over already with animal research, billions of U.S. healthcare dollars are spent on animal research each year. And this was found by Peggy Carlson. And also in 1993, for research and development, the U.S. spent about $16 billion. The fact that the country is spending such an excessive amount of money on animal research when it proves to be unreliable is absurd. Given the current state of our country, the money that the U.S. is allocating for animal research should be distributed to other important areas of human clinical studies, preventive initiatives, public health programs, and in vitro tests as well. Virgo points out in his article, Animal Experimentation is Unscientific, that we are going backwards. He gives examples of cancer and the country spending millions and millions of tax dollars infecting perfectly healthy animals. And with all this money being spent to eliminate cancer, the rate of cancer has gone up by 18%. And the deaths from cancer has gone up 7%. The money that was previously used for cancer experimentation, that obviously didn't do the country any good, can be used towards preventive measures. The three leading causes of death that Carlson points out in her article are heart disease, cancer, and stroke. And these diseases are often very preventable. Supporters of animal experimentation believe in animal experimentation having a great effect on medical advances. Most of the research, though, done on animals does not pertain to humans. Many researchers have proven that animal research misleads scientific research as well. Many medications that are given to animals are harmful to animals, but not humans, and vice versa. It's impossible to be able to tell the effects of medications giving to a human based on tests only done to animals. The testing of animals has also caused a delay in healthcare warnings, um, and also um, possibly the cost of millions and thousands of lives. It's very obvious that the country is spending too much money on animal research when they can be putting it towards other areas and the medical improvement of this nation and the health of this nation. The three leading causes of death, like I said, are very preventable, and that money could be used towards those things to help better our nation and help better the health care of our nation. Billions of animals are tortured and die from these experiments. So there's no logical explanation as to why we should still allow animal experimentation. The main reason why many support it is because they believe of the medical advances, but as I stated earlier, a lot of the advances in cancer and many other things have advanced because of being tested on humans, like the human guinea pig, like I stated earlier. So the rate of cancer has increased. So, I mean, what great advances do we really get from animal experimentation? And as closing, I would like to show you this picture. It's a picture of my dog. And I would hope to think that once you see how cute he is, that you would consider animal experimentation and think that it's wrong, because it really is morally wrong. And I hope that maybe I have impacted it a little bit. And thank you so much for listening to my speech.